Hi, it's Nathan here. We're talking about section 55A through 55D of the WHS regulations, and these sections cover psychosocial hazards. So one thing to remember is if you have these letters on the end of the regulations, it normally means there've been an addition. And the reason they put those letters there is because they want to insert regulations in sections that already exist. So for example, the regulations will already cover all the way up to regulation, 300 or whatever. And then what happens if you want to add something, you don't want to just add it to the end, you want to sort of slot it in up here. And so you don't reorder all the numbers, you just give it a letter. So section 55, just section 55 covers falling objects, but then after that, they've wanted to insert these psychosocial regulations, so they've made it section 55A, B, C, D. Now sometimes those additions will be from Safe Work Australia, but more often than not they'll be state specific stuff, so the states will go in there and put in clauses or extra sections. So psychosocial hazards were technically covered before they added this in there. The old definition, or the duty to provide a safe workplace or to ensure the safety of workers, extended to a worker's mental health before, but recently they added these new sections to provide specific duties, and there's a whole new code. Very difficult code to comply with. It's 50 pages or something. There's a lot of sort of controls that you could do, but it doesn't actually have like a list of rules like you should do these things. Very hard thing to manage. But psychosocial hazards should be managed. Give some examples in the regulations about things that need to be considered or managed. So job demands are probably the main one, I would say. To give you some examples on that, some really good examples. First responders, ambulance workers. Imagine what they're going through showing up to a fatal car accident. Shift workers, nurses, healthcare workers, where sometimes stuff happens and you end up, it could be a horrible work environment. You could be dealing with death and illness, and then you're stressed and understaffed and overworked and working long shifts. So that's another good example. Had the other example of a veterinary clinic, which I didn't really think would be that bad, but then they said they're putting animals down all the time, and who wants to be a vet? Generally someone would become a vet because they like animals, and now it's your job to put them down all the time. And then they gave some specific examples that we sort of had to help them manage, which was you'll have vets who have been there for 10 years and they'll deliver a puppy, take care of this puppy its whole life, periodically see it, and then 10 years later be putting it down because the dog has cancer. And the highs and lows, you'll go from one room of delivering puppies, that's one appointment, then into the next room of putting an old dog down and the owner's there crying. So yeah, lots of psychosocial hazards exist, but it's a particularly hard one for business to manage. So there is a code. The code breaks down into like 6 or 7 different things or different hazards that you could look at managing. So job demand, job control. It's not my specialty, but yeah, we have done risk assessments for clients before, and yeah, fatigue is another main one. Highly recommend consultation with workers through the hazard identification process and determining the controls. Hope that helps.